Well, hello and hello, and welcome to the Wonder Series, where here you have the opportunity to ask the questions that you have been wondering about, whether it's on health, wellness, personal development, or bringing some fun back into your life. We are here to help. And today we're touching on a subject that we talk about quite often in my house. And you'll understand why in a little bit. But we talk about obesity and we talk about diabetes quite a bit in my house. It is a topic that we know in this country is becoming an epidemic. And so what happens when your mom or your sister or your spouse goes to the doctor and they come back with the news, you know what, honey, the doctor told me that I have diabetes. Now what? Those might be some questions that you're wondering. We all think we know what diabetes is. And many times we think, oh, it's not such a big deal. You take a pill or you take a shot and you'll be fine. Well, today we're going to answer the questions that you have been really wondering about when it comes to diabetes and find out what diabetes is and isn't. And today I'm very excited to have two amazing guests with us. And thank you everyone who is here with us live. Welcome, welcome. Today we have Dr. Alexandra Kukla. She is a transplant nephrologist at Mayo Clinic. And Debbie Movsesian, who is a dear friend, and she is a physician assistant in cardiology at the VA hospital in Phoenix. So welcome, both of you.
Thank you.
Alexandra, I'll have you start. Just, tell us a little bit about yourself, what you do, your background, and yeah, let's just start with that. Tell us a little about you and your background and actually how you got here to Mayo Clinic, Rochester.
Sure. Thank you, Denise. Well, I just want to say that it's my pleasure to be here today and support your Living Healthy program. It's a wonderful thing that you are doing. So I'm a transplant nephrologist. I'm interested in kidney transplantation in particular, and also pancreas transplantation. Well, I was born in Poland, and that's where I graduated from med school. And then I have received several training in many different places in the United States, including Illinois, Wisconsin, Missouri, and finally Minnesota. So I worked at the University of Minnesota for several years and then moved to Mayo Clinic, mostly because so many exciting things are going on, especially in obesity and diabetes area. And since then, I've been really involved in all the programs that we are developing. So how the transplant nephrologist can be even interested in diabetes, someone may wonder, right? I'm not an endocrinologist after all, but diabetes and obesity has a lot to do with the kidneys. So unfortunately, about 40% of our patients are diabetic. Diabetes is fairly prevalent reason for kidney disease. And unfortunately, if not adequately treated and controlled, especially early, it may lead to renal failure and many of our patients that end up needing a kidney transplant. So that's how I got interested in that. And our main goal at Mayo Clinic is help these patients to get to the kidney transplantation as early as possible and have successful, healthy life after that.
Wonderful, thank you. Debbie, will you tell us a little bit about you, what you do, and your patients that you work with?
Yeah, thank you. Thank you so much for inviting me to be a part of this. I love what you're doing to just get the word out there. People have so many questions, and this is just amazing that they have this resource. So thank you. So as you mentioned, I'm a physician assistant. Most of my experience, I've been PA for 20 years, and most of my experience has been in cardiology. And I really kind of reached this point in my career where I just started to feel unfulfilled. And I kind of questioned, what am I doing? Did I go into the wrong field? I used to love this. What's going on? All of these emotions came up. And really, to make a long story short, I realized that I felt like I was putting a Band-Aid on a gushing wound, and patients just kept coming back into the clinic time and time again with more symptoms, with recurrence, weight was going up instead of down. Like they weren't getting results that they really wanted. And it just hit me that I wasn't being a part of a real solution that people wanted. And so that led me to find the American College of Lifestyle Medicine. And I just really found my passion. And it's that, I just love talking to people who are ready to take control of their own health. And I learned that there's so much that, like, as individuals we can do to turn things around. And instead of just kind of going through the motions and going to the doctor or, senior practitioner and taking that, medication, and hoping for the best, we really can learn what the underlying causes are of the diseases and then start to take some, action, change our lifestyle to really turn it around. And so that's what led me to do what I do now. I actually still work as a PA, but I also do health coaching on the side. And I try to educate people with really what is the underlying issue with diabetes and what you can do to actually turn it around. So.
Awesome. So this is going to be a fun conversation. Obviously, both of you work in the medical field, so you see patients in that way. And then Debbie, with your experience as a health coach, that piece is an interesting piece, because I think that's a piece where people can finally, take control of things that are happening, because we know. In our world that the medical world and the holistic world, call it, there's a time and a place for all of us. And I think it's really exciting when we can bring it together. So Alexandra, if you would tell us a little bit, because I think everybody thinks they know what diabetes is. Tell us a little bit, what is it? What is it not?
Sure. So there are two main types of diabetes. One is called type 1 and the other one is called type 2. Just to put it in a very simple terms, diabetes is the condition when the body is not producing insulin or not producing enough insulin. The so-called type 1 diabetes happens when the pancreas is not producing insulin at all or almost at all. And that happens mostly in children. It's about 10% of all cases of diabetes that we see. Now, type 2 diabetes is a lot more prevalent, and it happens when the body is producing insulin, or pancreas is producing insulin. In fact, it is producing a lot of insulin, but the response of the body is decreased because of what we call insulin resistance. And this is very closely linked to obesity. So once the people start gaining weight, their cells get clogged with the fat, and they would not respond to the insulin that pancreas would produce. And with time, pancreas would just get very tired. We'll keep producing insulin more and more, and at one point we'll quit producing or significantly decrease the production of the insulin. People will develop the condition called diabetes. So how we diagnose it? We usually diagnose it based on the elevated blood glucose. And we can talk about screening perhaps a little later, Denise. But diabetes does affect almost all the organs in the body. So it does affect the heart, does affect the kidneys, does affect the brain, does affect all the vessels, and can cause significant vascular injury. So it's the systemic conditions, not just the condition of the elevated blood sugar. It's those toxic effects of the blood glucose that we are seeing in our patients.
Mm-hmm. So the elevated blood glucose does what to people? Because that's, I said this earlier, we talk diabetes a lot in our house. But sometimes I kind of wonder, when you have this elevated blood glucose, what does that really mean? Yes, the glucose is elevated in the blood, but beyond that, what's the significance of that?
Sure. So elevated blood glucose is toxic. It's toxic to the cells. So when you have all your organs exposed to high glucose, you can see that your cells and endothelium, which is the part of the lining of the vessels, will become significantly damaged. And with this damage, our patients would develop a lot of organ failure or organ dysfunctions, as we mentioned. They may develop kidney failure, so they may need to go on dialysis because their kidneys are not functioning, cleaning the toxins anymore. So then they may become very, very ill from all those toxins which are in the body and are not being effectively cleaned. The diabetes or high blood glucose can significantly affect the heart. Again, it does affect the vessels of the heart, so the heart is not being perfused or does not receive enough blood flow. This is what we call coronary artery disease, and this is what we simply call heart attacks because of the clogged arteries in the heart and not enough perfusion. The part of the heart can die, and that can obviously cause or lead to a lot of problems, including death. It can cause brain problems. It can cause almost any other organ problems just because of this vascular supply being significantly damaged.
So it's a lot more involved than I think most people understand. Debbie, if you would chime in here when it comes to, your experience with your patients when it comes to glucose, because I know that's something that, as diabetics, they're always told, you need to lower your numbers. Talk a little bit about that.
Yeah, so I always like to say that when we talk about diabetes and controlling our glucose, that's like the tip of the iceberg. And there's so much focus on what can I do to lower my glucose? What can I do? Like she just said, obviously we do want to lower our glucose numbers because it can cause such havoc, but it's really just the tip of the iceberg. And what's really going on below the surface is what we need to talk more about, because it's one thing, and there's a lot of different ways that you can lower your glucose numbers so that it appears that maybe you're having some improvement. But if you're not getting to what's below the surface, which is insulin resistance, which is that clogging of the cells that she mentioned, the fat gets into the cells and starts to clog it up. And so if you think about insulin as a key, and your cells have like a million keyholes all over them, and the insulin comes and it unlocks the door for the sugar to go into the cells, and that's where you want the sugar to go. You want it out of the blood vessel, or out of the blood circulation and into the individual cells, so that it can be used for energy and stored for later use. And so if you're not getting the glucose into the cells, then it's building up in the blood vessel. And so what I'm saying is below the surface is that underlying insulin resistance, because it doesn't matter if you are lowering your superficial glucose numbers, if then every single time you have something like a fruit salad or some brown rice, and then your glucose shoots through the roof, because that underlying problem hasn't been addressed. And that underlying problem of insulin resistance, not only is it involved with diabetes, but it's been proven to be involved with, all of our most common, chronic diseases, including, heart disease, Alzheimer's, cancer, and all of those things. So what's amazing about it is then when you really start to address the underlying cause of type 2 diabetes, the insulin resistance, you're also lowering your risk of all of these other really scary diseases that can go along with it.
So I have a question. So you mentioned, with the key in the keyhole. So if the key can't get in the keyhole and there's this excess blood sugar running around in the blood, if it had gone into the cells would have energy. So what's happening to the person? How are they managing? How are they feeling when this isn't happening in naturally or normally?
Yeah, well, you can just imagine, like, every time you eat like a really big, heavy meal and you feel kind of after, you feel kind of lethargic, and you're not really full of energy and ready to run around, the block. You just kind of want to sit down and relax and digest your food. Well, it's because you don't have all of that energy in the cells, so that, each cell is producing energy. And so if you think about all of the billions of cells in your body creating, being very efficient and having all the energy that they can possibly have, you're going to be much more energized and feel like lively, feel vibrant, as opposed to that, post full meal, like that we're probably all about to maybe have in a couple of weeks here.
Yep, at least once in the next couple of months, right? So thank you for that explanation, because again, I think, for both of you, I think so often we think of diabetes, we think of one challenge, we think of blood sugar, and you've both explained that it's so much more than that and goes so much deeper, and explain some of the health problems that can go along. Alexandra, you and I had mentioned, or you had sent to me on an email about some questions about diabetes being a silent killer. What do you mean by that? And can you explain that a little bit more?
Sure. No, that's an excellent question, Denise. So what happens is that people with diabetes many times do not feel anything. So they gain maybe some weight, they still feel reasonably well. They don't have any obvious symptoms, yet the blood sugar is going up. About 1/3 of adult population in US has pre-diabetes, meaning that blood sugars are already elevated but not quite meeting the diabetes, and this is already associated with poor outcomes, including kidney problems and heart issues. Now, even when the blood glucose increases to the diabetic levels, lots of people would still not feel anything, and at one point they may present to emergency room feeling poorly, let's say because they have significant kidney disease, or they would present with the heart attack, they would present with chest pains, and someone would check the blood glucose and would say, oh, by the way, did you know that you are diabetic? And that's the news for many of our patients. So, but silent killer, I mean that if you do not follow with the doctor, if you do not get screened, you may live for years and have that damage from the blood glucose happening to your vessels without having any knowledge of it. So that's why it's so important to get a regular screening with your physicians, especially if you have risk factors for diabetes. And that includes some ethnicity or minorities have increased risk for diabetes. If you are overweight, not only obese, but simply overweight, BMI, let's say 27 to 30, this is already a risk for prediabetes and diabetes. If you are physically inactive, or you had perhaps gestation diabetes that happens during the pregnancy, that can put you at risk for diabetes, or some other conditions that you should get definitely screened above age 18. Pretty much everyone should get screened above age 45.
Okay, that kind of puts me in that. And I know I've never been screened.
I won't ask you for your age, Denise. I thought you were 18, but yeah, go ahead.
25. I think I'm 25. And here I think I'm 25. The rest of me sometimes does not agree. So I'm 45 and over. Wink, wink. What do I mean, who do I go to? What do I even say to a doctor? Because I apparently I have a primary care physician. Wouldn't know him if I tripped over him, because I don't go to the doctor, because I'm one of those people. If I'm not sick, I don't go to the doctor. Okay, for those of you who don't know me very well, my husband's a doctor, so a lot of times I just turn to him and say to him, "What should I do?" And I'm a relatively healthy person. More often than not, he'll just say to me, "You have a cold, you'll be fine." Those kinds of things. So I'm over 45. I should go and get a screening. Who do I go to? What do I ask them?
Well, primary care physicians have set of the labs that should be used for routine screening. And you should have your cholesterol screen, so fasting lipid profile. For diabetes, we routinely screen with fasting blood glucose as well as hemoglobin A1C. And what the hemoglobin A1C is just the hemoglobin, or I would say red blood cell content, that if exposed to the high glucose or sugar environment will increase in the blood. So that's the test that we use for the screening. So blood test, it's all you need to be screened for diabetes in the initial screening process.
Mm-hmm. Okay. Now, Debbie, I know you work with your clients and your patients about, you talk to them about lowering A1C. And as we've said, this is one aspect of it. Talk a little bit about, if I'm one of your clients and I come to you, I have maybe prediabetes, I have elevated numbers. What do you say to me? How do we work together? How do you help me get to that living that healthy, happy lifestyle that I'm dreaming of?
Yeah. Well, first of all, I would ask you, well, what are your goals? What are your concerns? What are your hopes? What are your dreams? Because it's one thing to talk about a disease. It's one thing to talk about, here are some options, here's a medication. But what's really important, and I think missing a lot in Western medicine, is really connecting with the patient and finding out, what do they want? If they say, well, no matter what happens, I don't want to go on medications, like my husband, when he was told he had prediabetes, he's like, I'm not going on medications. Well, that person you may talk to a little bit differently than someone who is, well, I'm on 8 medications, and is there anything I can possibly do? So it really just depends on where people are in their journey, their disease journey, their health journey. and what their goals are. And so I start there and ask people, well, what is it that you really want? Because if they get clear with what their goals are, as opposed to what their practitioner or their health coach is telling them, then it's going to be much more meaningful what happens after that. And so if they say that they want to do everything they can to take control of their health and they don't want to be on medications, and they're very clear on that, then the next step is, okay, well, where are you at now? And being really honest with yourself. What habits do you have right now? What are you eating? What's your lifestyle like? How are you contributing to either getting to the goals that you want or actually contributing to the underlying problem? And it's really important for people to start to realize what it is that they're doing on a daily basis. And what I love to share with people is that 80 to 90% of our daily actions are done subconsciously. There are habits that we have built over our lifetime. And so if you truly want to make change, then what you get to start with is what your goals are and what your current habits are. And then to start to kind of nitpick at those habits and what can you start to make changes with? How committed are you? Some people kind of have I'm all in, cold turkey kind of personality where they're like, tell me what I need to do and I'm doing it. And they'll do it, they'll run with it and they're successful. But most people actually aren't that way. And so it's really important to know where you are in that kind of journey as well. And what are you willing to commit to? Because I don't want to tell you this is, do X, Y, and Z if you're not even close to considering doing X. And so the biggest thing I would say to kind of like, to sum it up is that I really look at what people are eating on a daily basis. And I try to point out how nutrient dense those foods are or not. And to me, it really starts with bringing in more really nutrient dense foods, more vegetables, more fruits, more legumes, more whole grains, and to really evaluate the foods that they're putting in their body and helping them understand the difference between, plant-based proteins and animal-based proteins, and same with carbohydrates and same with fats.
Mm-hmm. So this is an interesting conversation when it comes to diabetes or type 2 diabetes, because we know that, a lot of the patients are overweight and obese, and obviously diet is part of that. So Alexandra, I'd like to have you chime in when it comes to your patients and diet. Like what are they saying to you? What is their biggest challenge?
So Denise, I see mostly patients who have kidney disease, and that's when it gets more challenging because many of our patients cannot eat what other people with normal kidneys can eat. So some veggies and some fruits are out because of the mostly electrolyte contents, for example, potassium. So we really have to work very closely with the dietitian to find the right food for our potential kidney transplant recipients or patients who have already significant damage in the kidneys from diabetes. And that's very important that every of these patients would engage with a very close follow-up with the dietitian, and still we would very strongly encourage them to work on weight loss and wait on the dietary changes. I have to tell you from my experience though, is that a lot of our patients who already have kidney disease are not able to do it, mostly because they may struggle with some depression related to the chronic conditions. Their life is very busy, they still try to handle a job, and maybe they will have to now go on dialysis because of the kidney problems. So it's tough. We don't have a lot of success with just advising the exercise and diet. I just want to tell your listeners that despite that, the help is available for all of these patients. So working with dietitian, of course, is a key, but also there are some medications that can promote weight loss. There are now new medications that are available on the market that will also decrease the insulin resistance, and that may be important and will promote the weight loss that way. And lastly, there is the option of having what we call metabolic surgery, which is weight loss surgery, that will hugely make a difference in many of these patients' life. And I think if you have someone, or if you know someone who has tried dietary modification or increased exercise, and either it's not working or this person is unable to do it, I would strongly recommend that that person is being seen in weight management clinic or the other options. will be presented. I have seen many times that unfortunately we do advise just the dietary changes or lifestyle modification that doesn't work. Our patients would develop then diabetes, and we watch them to develop progressive organ dysfunctions, yet they would not engage in the weight management clinic. So that is really important to stress for your audience and all the other patients.
So it's interesting. So really we've got, so Debbie, you work with people kind of before they get to the place where they're seeing Alexandra. And again, this is Dr. Alexandra Kukla, who is a transplant nephrologist. So I think working together is really intriguing because there's a spectrum of people, we know that. And I think the information that we have when it comes to diet and exercise, and also metabolic surgery. I have a friend who had bariatric surgery sometime last year, and this was a woman who was 150 pounds overweight, had a lot of health issues, obviously, had some depression, and really was at a really bad place in her life. And bariatric surgery actually saved her life in so many ways. But she even says, I wish I didn't get to that point. So truly, we're looking at helping people not get to that point, but then when people are at that point, how to help them best. Yeah. So it really does look like there's a spectrum of patients that are out there. I want to ask a little bit more, about patients who have diabetes. Beyond the place, they've been diagnosed. Maybe they've had diabetes for the last few years, and right now with COVID running rampant, we know, we've been told many times, people with underlying conditions are at high risk. Why does diabetes, why is diabetes in that category? Or
Sure. So we've known already that diabetes does increase risk for infections. So even before COVID era, our patients have suffered from infections of the skin, infections of the legs. They require amputations, mostly because poor perfusion and decreased immune system. And that is what makes them more susceptible to a pandemic like COVID. The immune system is not working as it should. It's not as robust. And besides, patients with diabetes as well as obesity have a low-grade inflammation, and that really impacts or allows those viruses to attack the organs and put those patients on a really disadvantaged place that when they get infected, they usually suffer through this disease a lot harder than other patients and require hospitalizations and have increased risk of death.
Mm-hmm. So Debbie, I'm going to ask you, when it comes to these patients in COVID, we talk about, would you talk a little bit about, the immunity piece and how what you do and help patients with, how that can help with the immunity piece?
Oh, absolutely. Well, as I said earlier, the amazing thing about what I do and how I help educate people with getting to the root cause of type 2 diabetes, which is that insulin resistance. Plant-based nutrition is such a key part of it, and it plays a role in all of these other things, because what you're basically doing is you're flooding your body with more nutrients. I mean, most I would say across the board in America, like 10 to 12% of what people eat are the nutrient dense foods that are meant to nourish our bodies and what our bodies are desiring. And that's the whole foods, like fruits and vegetables and beans and whole grains and nuts and seeds. And most of what people eat are processed foods and animal products. And so if you think about it, if you've got like the healthy foods are down here and the unhealthy foods are up here, of course you're going to have some difficulty with your immune system and with all of the normal bodily functions. But if you can start to, tip the balance the other way and start making substitutions and start bringing in more and more and more of the whole foods, the real healthy foods, then everything in the body just starts to work more efficiently the way that it's supposed to. And one of those big functions is our immune system and inflammation and all of that. And, you know, there's a difference between acute inflammation and chronic inflammation. And I'm referring to that chronic, that low level chronic inflammation that's been shown to be linked to so many of our chronic diseases. And there's so much research now that shows that the more nutrient dense foods you eat, you know, the less chronic inflammation that someone's going to have. And so all of it just plays a role together to optimize our body systems. And again, that includes our immune system.
Mm-hmm, mm-hmm. And Alexandra mentioned the inflammation piece with her patients as well. I'm going to take a minute and open up for conversation, questions, comments from our audience, thoughts. Miss Suzanne, you can unmute you. There you go.
Hey, thanks so much, guys. This is really, really helpful. I deal with so many people who are overweight, and not only in my personal life, friendships, family members. How can we be more proactive with helping them in a kind, I mean, I try to lead by example, but sometimes that's just not enough. And you want to encourage people to be more proactive about their own. Any recommendations for that?
I think it's a very difficult question, because when we see the rates of obesity are really increasing, and we now have been talking about obesity for years. There are some campaign regarding better food choices. There are some initiatives like Denise is doing, and still, instead of improving the situation, we see that obesity rates are increasing. We have a lot of enemies in that field. So when you look at advertisements, for example, for the children and for the adults, all you can see, for example, sugary cereals being advertised to children, or chocolates and candies, or sodas. During those advertisements, you can see like someone sitting in a nice place, maybe in Hawaii, drinking Coke, right? So how beautiful, how healthy that should be. So there is a lot of enemies. Well, I think that should start from the person inside. I don't think you can convince someone that someone needs to lose weight. I think leading by example, as you are doing, and from time to time maybe providing some articles or literature gently, or discussing better food choices is probably the way to go, and why you're doing it and how that makes you feel. It's probably the way to go. Whether and how much that will be successful if someone is not convinced that that's the way to go, it's probably a challenge.
Well, and I think yes, completely. But then I also think there's also this other side of the spectrum about, you know, being body positive and, you know, not feeling bad because you're 30, 40, 50, 100 pounds overweight, like still liking yourself. And I think the conversation needs to be around that you can still like yourself if you're overweight and appreciate yourself, but you want to be healthier. And healthier is definitely not 50 plus pounds overweight.
Right, definitely not. Yes, and even if someone is overweight and healthy or feels healthy for now, probably will not in years to come. So it's very important for that person to start working on their weight.
Carly, you have something to add or ask?
Yeah, I just wanted to add to Suzanne. So I'm a dietitian, and I know it was quiet when we first started. So I would say, to your point, what I do sometimes is like talk about like my lab work and like the other, not just the weight, but all the other like measurements for like what is healthy, how good I feel, how my skin is clear, my sleep's been better, my energy's been high. Like I talk to my own, like when I talk to, you know, my own clients about it, that the weight always seems to be like the one thing that everyone focuses on, like the power we give to the scale, but like bone density, body composition, muscle mass versus fat mass, like having those conversations really like make light bulbs go off for people. Cause it's like, you're like teaching them something that then on their own time, then you just leave it to them to apply to themselves. And then just kind of get excited about how all those things are good for you, I guess. Like my vitamin D is amazing. Like, it's the stuff on the inside that you're worried about. I love what you look like on the outside, but it's the inside metrics that, and I work with like some younger athletes too. And like, they've never even considered lab work. They don't even know what it is. And I'm teaching 16-year-old girls to understand what an A1C is. I'm like, you don't need this now, but you will later in life. So.
Oh, that's great. My niece is she's a athlete and she's 18. It'd be interesting to have you guys connect, have a conversation with her because she's looking to go to college and possibly run on the track team.
Yeah,
Bill, I think you had something to say.
Yes. First of all,
Sorry,
thank
Carly,
you.
I cut you off there.
No, you're good.
It's so informative. And I had a question. Debbie, like you, I've been consumed by the ACLM. It's just taken over my life and given me entirely new purpose for a lot of reasons. I'm having dinner with the head of the ABLM tonight. But I wanted to ask you, when your first intervention is diet and lifestyle change, what are the biggest challenges you have getting people to comply with that?
I would say probably right now, the biggest one would be the support or lack of support with their family. The people that end up working with me are pretty motivated. They're ready to make change, but it's the spouse or the family that, oh, I don't have diabetes, I don't need to worry about that. That's really, I find, one of the biggest challenges. And that's why I love doing the coaching aspect of what I do, because I can help fill some of that void by providing a community of support for them. Because if they're out there doing it alone, it's going to be so much harder than if they are like, okay, maybe my spouse isn't on board today, but I know that I can talk to all of my new people that are in this community that are going through the same thing I am. And I think that community support, it's something we haven't even talked about yet today, but it's so valuable. And there's some gurus out there that's like one of their big main focuses is that love and that community and that support that people need. And so I just try to help people get the support where they can find it. And like, even like what you were talking about, Suzanne, and just being that example, talking about why they're doing it, talking about the success that's coming from what they're doing. And then little by little, with a lot of people, it does infuse into the family. And if you're not pushing it on them and they're only observing, they're going to be much more open to like, they've got something going there. And this isn't just some, fad or quick fix. Like, they're really making changes. They're really committing to their health. They're seeing changes overnight or, within a few days. And I found that's one of the biggest obstacles, but it's actually very rewarding to see when people start coming around, when they're able to get the support they need at the beginning from, strangers at first. So.
Yeah, it's really interesting. We're launching a meal delivery program specifically for healthcare providers to start prescribing clean, whole, plant-forward meal plans, utilizing food as medicine. But we're also starting a clinical trial with one of the largest payers in the country right now. And it started out as just the food, and they wanted it all heat and serve ready, but farm fresh, clean, whole, plant-based meal plans. But then it became very important. They added another arm for cognitive behavioral coaching to be part of it. And it keeps coming more and more. You need that coaching along the side. So I appreciate your response, and we hope we can add something to the tool chest of lifestyle medicine and other healthcare professionals to utilize food as an intervention. It's our mission to help eliminate all these chronic diseases that are plaguing the country.
I would definitely connect the two of you later on email. And Dr. Kukla, Alexandra, it might be interesting to have a conversation with Bill too, considering all of the things that are going on in your practice. So I'd love to connect the two of you as well. because I think the more education and information that we can share, the more we actually help our patients, our clients, our friends. I have a question that is from Luann. Hi, Luann. She asked, if you are tested for diabetes and told that you're not in a pre-diabetic condition, does that mean that you are not insulin resistant?
I would say no. Just because the blood sugars are still in the normal range, if you are overweight, you may be insulin resistant. It's just not showing on the blood glucose level. So everyone should work on the weight loss with dietary and exercise modifications, because our patients or people who are not pre-diabetic or diabetic yet may very well be down the road.
Thank you. Additional comments, questions, thoughts?
Yeah,
This has been
that's a great question I see here. So how do you test for the insulin resistant? So we do not formally test our patients in the clinical practice. However, you could be very well tested if someone would. So how you do that, you can give the patient what we call mixed meal. It's the mixture of some sugars and protein and fats, just to imitate the normal meal that you eat. And before that meal, we will measure the insulin level as a baseline, and then have you drink that mixture of nutrients, and then retest your insulin. And then we can see how high your insulin levels would go up. And if they do increase significantly, that means that you may be insulin resistant just because your body response is such that it's not enough to increase the insulin levels to the normal level, but you really have to significantly increase your insulin to push that glucose into the cells. There are other more sophisticated measures of insulin resistance that are being seen in research environments, but this is probably the simplest one that someone could do.
Wow. Well, it seems like we've got lots of help for people out there. We have lots of information for people to access. We have two amazing professionals here who are available for people to connect with. I would ask, because I know Carly, you were chatting about athletes. I'd love to kind of hear a little bit more from you, your thoughts about our conversation today as a nutritionist,
Yeah, absolutely. I think, I mean, obviously I was an athlete, I played lacrosse at USC. So I have a very personal experience with the nutrition as it applies to sport, and then how that you have your high school transition into college sports, and then you have college sports transition into real life. And your nutrition needs change pretty drastically, probably the most from sport into real life, which is what I'm experiencing now. So I think while as the younger athlete needs a lot more, carbohydrates is something I feel like the general media will scare a young girl who has potentially body image considerations of what she should look like, and then is taught to fear carbohydrates. Or maybe has a family member with diabetes and fears it that way, when really they need them. So it's just a matter of really addressing the quality of food, which I think a couple people have mentioned today. And it's just teaching them that carbs aren't bad, but the quality of all macronutrient food groups, just teaching them those things, teaching them that they need a lot more food as a growing young person who's doing tons of activity. But if they're able to choose the quality, then transitioning to maybe less calories post their athletic career, but they know where to search for foods in the right places. It's already embedded in what they're doing. So, and at Nutrition for Longevity, which I love, is we're really highlighting the quality of food and making that really, really easy for people. And especially a lot of college kids that I've talked to, even in my own family, access to food. At Harvard, I think at one point, the lacrosse girls on campus that I knew, they were getting bagged lunches from the cafeteria because they weren't allowed to go in, not always stuff that they liked. Harvard is great. I'm sure they have a lot of good stuff, but having meals delivered to your dorm would be amazing as well. And I know Nutrition for Longevity, ours are incredible. So I don't know. I think there's definitely a space for that, and just making that stuff convenient makes it so much easier for diet compliance.
I think it's really important because, so I was a high school college athlete myself, and I still think of myself as an athlete, though a much
You
slower
should.
runner. And it's very true. You know, when you're in high school and you're in college, athletics is very different. And I'm not the only one who has noticed this. You know, I notice as soon as like athletes get out of college, you know, maybe not the first year or the first couple of years, but within the first 5 to 10 years, all of a sudden these people who are incredible athletes, you know, strong and fit, are 10 and 20 and 30 to 50 pounds overweight. So there's definitely, you know, some transition that people need to make. And I think that's really, you know, talking to kids is important, because they need to know their nutrition. I mean, I know I talk about my niece a lot because she's kind of she and I chat quite a bit about nutrition. And as an athlete, you know, she struggles to figure out, you know, how many calories should I eat if I'm doing this, and she's paying attention, where most of the girls that she runs with, they're not paying attention. They go to, you know, to what's Wawa there, Quick Trip here in Minnesota, you know, they'll go in and they'll grab, you know, candy bars and chips, where, you know, she'll grab a banana, and they make fun of her.
Yeah, that was me.
Yeah. But, you know, she'll probably have less challenge with the transition than some of the others. So I think it's interesting to touch on that, you know, when it comes to this education piece that all of us are about. I think it really is, you know, it really does kind of go back to, you know, the foods that we eat, and being at a healthy weight. And healthy weight, I think, isn't a unique phrase, because there really is a range. You know, it's not necessarily the same number for each person. I'm 5 foot tall. You know, my best friend is 5'9". You know, if we both weighed the same amount, I mean, she'd be a twig. Well, she'd be a twig, and unhealthy. So I think it's really important for all of us to understand that when it comes to nutrition and healthy weight, that we really do need to focus on, you know, what a healthy weight is, and options and opportunities to help them get there.
Yeah.
Thoughts? Anyone? Questions?
I would just say that one of my biggest focuses is, or one of the things that I talk about quite a bit is trying to stop talking about weight, actually, and talk more and more and more about healthy food. And the more healthy food you eat, the less you have to worry about the scale, the less you have to worry about weight loss, because it's just going to happen. And I truly believe that the less someone focuses on their weight, and the more they focus on their health and their health goals and the food they're bringing into their body, the more they will just naturally lose weight. And so that's a big part of my program, is to shift that whole idea of weight loss and focusing on the scale, and start focusing on long-term health instead of, you know, the number. So
I just want to add, Denise, that it's not all about food and exercise. I think addressing psychosocial problems in our society is also critically important, because a lot of our patients, and also healthy people who are overweight, they may use food as stressor relief. So if they get stressed, they eat more. If they're depressed, they eat more. If there are some life challenges, some people may want to eat more. So this is also critically important, and I think probably underrated issue.
I think you're right. I would agree with that. The people that I know who have who've had either bariatric surgery or who are diabetic, several of them have had those kind of issues as well. So I think you're right. That's a really important thing to be cognizant of when we are out and talking to people and connecting with people.
And now we see that with COVID as well, a lot of our patients would gain weight, and they were educated before. Maybe they were on the right track before. Maybe they were cooking the right things before, but now it's maybe more harder to go out and buy stuff. And maybe it's more time consuming, and they start gaining weight, and their diet is not as good as it was before. So that's another aspect of being stressed.
Yes. Yeah. Stress eaters. Yeah. When you were in college and you were a stress eater, it was a lot easier than being a stress eater at 45 and over.
And you don't even have place to go and exercise right now other than outside, right? So for a lot of people, it's hard.
Yep. Yep. And outside has been great here in Minnesota until today.
Yeah. Yes, that's
I
correct.
would say I'm pretty impressed with, I'm a fitness instructor too, and I've just seen so many different gyms and fitness centers. And even like as an individual, like I'm hopping on Instagram and doing like workouts, and you can go live and people can join, and some people watch and do
Sure.
one round. And I'm like, all you need is a chair, just get up and like do some squats, you know? And it's like funny to see people, some people take it to the next level and like add weights that they have at home and stuff like that. I'm living with siblings right now, and like we're always finding new and exciting ways to move, because when you sit for this long,
Yeah.
Bill and I always talk about the Zoom fatigue that we get. Like it's like I crave it. So
Yeah.
Well, Carly, if you're doing those exercises, we all need your Instagram and to follow you on Instagram. So next time you're live doing your chair exercises.
please do. I would love that.
And I think that would, you know, really, I think this is what Living Healthy List is about. It's about this information and education and this connection that we can help other people to live that life that they're looking for. You know, everyone's looking for, you know, a healthy lifestyle. No matter what they say, they want to be healthy, they want to be happy, and we are here to help people to do that. So I want to thank Debbie and thank Alexandra for joining us today. Thank you for those of you who are here live. And for those of you who'll be watching and listening to us on the replay, you can always connect with me at support@livinghealthylist.com. And I can answer questions. I can forward you information. I can give you Debbie's information. Alexandra, I don't know if you're open to an email. You just let me know and I can connect people to you who have questions. Anyone last minute question before we head off?
You want to pay me? Thank you, Denise. That was great. It was nice meeting you all.
Thanks for
Thanks,
having
Bill.
us.
Thanks, Carly.
Yeah,
Have a
good
great
seeing
day,
you
everyone.
guys.
Thank you all.
Thank you, everyone. And we'll see you next time, second Tuesday of the month at for the Wonder Series, hosted by Living Healthy List. Thanks, everyone.
Bye.
Bye-bye.